right? That is the first step. Get them out of pain. I'm getting them out of pain for two reasons. One, quality of life. And then what you and I care most about, how are we going to prevent this pain from coming back? You know, they fear the worst. And so they immediately say, I need surgery.
It's usually not just one thing. There's a host of things in the whole contextual picture of, you know, what you're dealing with. And then on the flip side, that the body is more resilient than we think it is. Hey guys, my name's Ken Clark, owner of Purpose Physical Therapy and host of the St. Pete Professional Spotlight Series. And today joining me, I have a special guest that I have deep respect for, Dr. Gregory Mines out of All Florida Orthopaedics. Dr. Mines is a board certified sports medicine and family medicine physician with a dynamic background in both elite and everyday athlete care. Dr. Mines takes a performance-focused, evidence-based approach to musculoskeletal health. Whether he's working with youth athletes, weekend warriors, or national teams, his goal is simple: help patients move, perform, and live better by tailoring treatment plans to their unique goals and activity levels. A Clearwater native, Dr. Mines completed his medical training at the University of South Florida and went on to pursue advanced fellowship training in primary care sports medicine at the prestigious Steadman Hawkins Clinic. Along the way, he served as team physician for the USA Karate National Team, the Greenville Drive, which is a Boston Red Sox affiliate, and multiple collegiate programs. Not to mention providing medical support at triathlons, marathons, and cycling events nationwide. Whether he's diagnosing complex joint pain, managing overuse injuries, or helping active adults stay in the game, Dr. Mines brings both elite level experience and a down-to-earth commitment to personalized care. If you've ever wondered what it looks like to combine cutting-edge sports medicine with everyday primary care, this is definitely a conversation you don't want to miss. So welcome, Dr. Mines. Thank you so much for joining the show. I'm super glad to have you on.
Well, thank you, Ken. And the respect is mutual. I appreciate everything you guys do as well. You know, obviously, you guys being the physical therapists, this is a team attack on professional athletes and their medical care. And with that being said, I'm very humbled and appreciative and thankful for my wonderful introduction, which makes me sound very skilled. And so I'd like to hopefully say that's true, but we'll talk about some good subjects here today. And I hope this will be good for your listeners.
Absolutely. Yeah. And definitely for the audience and the listeners. I'd love them to kind of learn a little bit more about you. So before we kind of get into what you do, I'd love to hear your story and your why. Like, is there anything specifically that drew you to medicine or specifically to sports medicine at that?
Those are great questions. And yes, I do have some history. So I myself am an athlete. I grew up playing sports. I was a very competitive soccer player at a young age. Unfortunately, sustained multiple knee injuries at ages 9, 10, and 12. And so I had 3 meniscus tears on the same right knee. 2 of them were repaired. One of them was a meniscectomy at age 12, which we know is not a great option. You know, especially leading to later pathology in that knee. But with that being said, you know, I had great exposure and I had a great team of doctors that walked me through decision making and, you know, really kind of put my life in their hands, both figuratively and literally. But with that being said, you know, I also had a father who was a physician, so I got to see how he made an impact on a daily basis with people. Obviously, he was not a sports medicine doctor; he was an ophthalmologist, but still, the impact of helping individuals and changing the quality of life was there. And so between these two experiences and my love for sports and athletes, you know, I pursued medicine. When I was in medical school, I got to work with a huge amount of different patient populations, a bunch of different specialties, and I kind of kept my options open, and everything kept pointing back to sports medicine. I really liked working with that specific patient population. Now, when we define that patient population, like you said, it can range from a weekend warrior all the way to the international high elite level athlete. And so, you know, I don't discriminate. I'm happy to help either of them. You know, sports and physical activity are a huge part of our lives. And on top of that, just activities of daily living require function. And so my goal, like I said, and like you reiterated, is to get these people to their goals, which whatever that may be. You know, some people, their goal is to run a marathon. Some people, it's an Ironman competition. Others just want to be able to walk the trash to the curb or take the mail out. And so, you know, I'm happy to fulfill those goals and help people to reach their goals and obtain them in any way we can. And obviously, that's an individualized treatment plan. So, you know, I went through medicine to get to the point where I can help people like that, come up with those plans and get people a better quality of life.
Awesome. Yeah. Love that. Love that. And, growing up in Clearwater, here doing sports and stuff, is there any specific, values that you grew up with that you take into your practice as a physician?
I think the key to understand, and this is what, I was lucky to go to University of South Florida Morsani College of Medicine, and what they really preach is the individual aspect and the holistic approach. And so,
Mm-hmm.
we hear about the structure of, oh, if you're in medicine, if you have this injury, you do this. If you do that, if you have this injury, you do this. And I
Yeah.
think in the past that might have been more of an algorithmic type of scenario. I think we're shifting in medicine to preventative care rather than reactive care. And I think
Mm-hmm.
along with that, it's a very individualized treatment plan. And so, my morals and values are, look at the human, get to know the human first. That's who I am. I'm a very big extrovert. I talk to everyone on the street, for better or for worse. With that being said, you can learn from everybody. You can learn about themselves. You can learn about
Mm-hmm.
yourself through people. You can learn about your environment. And so I translate that over to medicine is when I'm in the room, we're chatting. I'm not spending time looking at the
Yeah.
computer. Of course, I'll look at the images. I'll look at your history and your notes, but hopefully I've done that in advance. And with that, we're spending more time understanding you as a person. And from there, that really translates into an optimal treatment plan that hopefully will come to fruition and get you back to your quality of life. So I think that's where my morals and values and my upbringing come into play of just
Mm-hmm.
really, yes, you're a patient, but get to know the individual behind that patient first. And then from there, know their issue or their pathology, and then combine the two to come up with a good plan.
Yeah. Love that. What specifically keeps you motivated in doing what you do? Because I know everyone's human, but is there anything in particular that kind of gives you the fire, the spark, to keep going? Because there's a
Absolutely.
lot of
Absolutely. Every day I have small wins in the office, and even though they're small wins for me, they're large wins for the individual. And having the patient come back and tell me that a procedure that we did was life changing, or an intervention we did that was life changing. I mean, that's what keeps me going. Seeing the successes, seeing people take a new joy in their own lives, having higher function, better capability. I mean, that's what lights the fire in me and keeps me going on a daily basis. There's days that are obviously frustrating, and the wins may not be as apparent or as many or as high volume. But with that being said, when you get those wins with individuals and their care comes to fruition and their goals come to fruition, I mean, it just keeps me going every day, and it brings a huge smile to my face.
Yeah, awesome. And speaking of success stories, does anybody in particular come in mind? Of course, not giving away any personal
Absolutely.
information. Yeah.
I had one yesterday. I had a gentleman come in, tell me his knees are life changing, and the fact that
Awesome.
he has significant arthritis. So this is an overweight, kind of 50-year-old man, has really been struggling. Went to see a surgeon locally and was told he needed knee replacements. And the answer is, his sugars and his body weight don't allow for a knee replacement right now. So, he was passed on to me. We've done some small interventions with, a few injections. He's done a lot on his own, so I've guided him. But, it obviously takes effort from the patient as well. Yesterday, he told me he's down 20 pounds. His knees are without any pain. He's biking and walking more than he used to. He's ditched his walker. He's now using a cane. I mean, he just said that he literally was crying to me and saying that this is life-changing. And so when you talk about what keeps you going, I mean, it's hard to say that having an experience in a moment like that with another individual who a few months ago was a stranger to me, but now I consider a friend and a patient. I mean, that is what keeps you going on a daily basis. And it's those success stories that, make me feel like I can make a difference in others' lives.
Yeah, it's amazing. I love hearing those types of stories.
Yeah, he's a wonderful man. He deserves nothing but the best. And
Yeah.
so to have someone, not that the surgeon just wrote him off, because obviously there was contraindications to the surgery, but this is somebody who may not even need that surgery going forward. And if they do, they are now readily equipped and prepared for it.
Yeah, absolutely. Agree 100%. And so let's talk about a little bit, Dr. Mines, about what you actually do. I know your title is you're a non-operative or a non-surgical orthopedic physician. I know for those in the audience or those that might listen or see this, they might not really understand kind of what you do. What is it? Can you explain to them?
That's a good question, because I think there's a lot of people out there that don't know what exactly I do or what my job title is. And even still, some of my patients are confused by it, but they're happy that I can give them good care. So this is a newer field. I think that this is a field that it became a field in the fact that it's needed. So you obviously have orthopedic surgeons who are wonderfully talented in surgical interventions, and with that they love surgery. But a lot of times, or majority of times, I would argue, the sports medicine musculoskeletal injury doesn't require surgery. And so I am a bridge between the primary care physician and the orthopedic surgeon who could fill in that gap and provide good care to people who either want to maintain, prevent, or recover from injuries that don't require surgery. So specifically, what makes me qualified to do this is, like you said, I went to family medicine, had a great residency in family medicine at Bayfront locally here in St. Petersburg, Florida. Working at a trauma center, got some good experience in the surgery ORs with my orthopedic surgeons, with others, with cardiothoracic surgeons. And then from there decided, I personally don't need to be in the OR, and I see a lot of option and opportunity to help people without surgery. And so from there, I went to the non-operative sports medicine fellowship at Stem & Hawkins, combined my love of athletes and helping individuals who are active stay active or become active. And so that training has really geared me to help patients non-operatively. Now, what do we mean by that? Well, we do a lot of things. So we have medicines, therapies, ultrasound-guided injections, regular injections without ultrasound. We have testing. I think the most important utilization and tool I bring is my diagnostic skills, my hands-on diagnosis and approach based upon listening to the patient, hearing them out fully, understanding the situation, not just jumping to conclusions, using objective data such as X-rays, MRIs, any kind of scans that we have as a modality that gives us information, but not as a definitive diagnosis, because oftentimes we find diagnoses on there that aren't truly pain sources in the moment, even though they could be potential pain sources.
Correct.
So I think differentiating between what is a pain source and what is actually just an incidental finding is key in this practice. And then from there, putting on implementing a treatment plan that is specific to that diagnosis, not just, oh, you have back pain, let's get you into physical therapy. Oh, you have knee pain, let's get you into physical therapy. It's like, what in the knee is causing the pain? Is it the meniscus? Is it your ACL? Is it your patellofemoral aspect, right? Meaning that the tracking of the kneecap is not the problem. If we start addressing meniscus concerns and really it's in the kneecap, you're going to have recurrence of your symptoms because we haven't addressed the underlying concern. So I think where non-operative orthopedics is a mainstay is that we offer multiple modalities, whether that's, this new regenerative medicine, which we can go and talk about that all day with PRP, stem cells, ADM, BPC 157, all these molecules that are being studied and tested, which will likely be very, very key in medicine going forward, although we may not have all the answers right now, and that we have to be careful with some of those. And that's a whole nother discussion for a whole nother day. But with that being said, we can integrate and discuss the pros and cons of each of these in combination with your specific diagnosis to come up with that individualized plan instead of saying, hey, you need surgery, hey, you need this. And ultimately some injuries do need surgery, but we can do our best to keep you away from that surgeon or keep you off that table, and most of the time we are able.
Yeah, totally agree. I love that. That's awesome. And so staying on this topic a little bit, what you mentioned, the knee and back and stuff like that. So what are some kinds of injuries or conditions that you most commonly treat over in your office or your clinic?
Absolutely. I think the most common injuries are either overuse injuries in all ages or kind of arthritic degenerative recurrences and aggravations. And so obviously we all kind of age. Gravity is wonderful to live with, but it's also something we need for our bones. And unfortunately, it causes wear and tear on our spine and our joints just by living on Earth. And so, we constantly get aches and pains in our joints. Those are some things that I can deal with. Ultimately, some of them may require surgery for joint replacements or additional interventions. But in the meantime, when it initially starts, a lot of times we can manage these symptoms. We are not taking the arthritis out, but we are managing the pain, the inflammation to allow you to be functional, as these arthritic changes have been going on for decades, but only recently became painful. So it's not like it just happened yesterday when the pain started. Other things, overuse injuries, tendonitis, muscle spasms, strains, irritations, tears, all the above. We really are shying away from operative medicine as much as we can. And I do believe the future of orthopedics is in regenerative medicine. We just need to have more information. And regenerative medicine meaning, understanding the physiologic processes that are natural in the human body, and from there being able to manipulate the signaling molecules so that we can control the processes when we want them on a timely manner. Now, granted, we are not there yet, so please don't take this conversation as, oh, this is an end-all be-all. There's a ton of research and work that needs to be done, because right now we don't know what volume of those are. What are the contraindications to those? If we take a signaling molecule and put more, could we trigger another pathway that wasn't there previously? These are the questions we need to answer.
Yeah, totally. That makes so much sense. Love that. So I know this a little bit because we have mutual patients and we send patients to each other, which is awesome.
And I
And it's
appreciate
great.
that.
Yeah,
And I
totally.
appreciate you and your team.
Yeah, likewise. And so for the listeners, talk about how your approach, your philosophy, what you do in the clinic, how does that overlap or collaborate with someone like a
Excellent question.
physical therapy clinic?
Excellent question. I think, yeah, and I think the main point to start out with is the treatment plan doesn't end when you leave my office, right? The
Mm-hmm.
treatment plan starts when you're in my office. So first things first, people, no matter how many times you say it or not, people typically present to me with pain, right? Pain is
Yeah.
the source, the signal that is sent to the brain that says something is wrong in the body. And typically that is a fracture, an arthritic aggravation, a tear in the muscle, a muscle spasm. It could be a whole host of things, but it always starts with pain. So
Mm-hmm.
to answer why the patient is here, I need to deal with their pain, right? That is the first step. Get them out of pain. I'm getting them out of pain for two reasons. One, quality of life. And then what you and I care most about, how are we going to prevent this pain from coming back? So I'm creating a window of opportunity to make physiologic or structural changes, which then prevents the pain from recurring. Because ultimately, if I just band-aid the pain, in due time, unless it's a fracture that heals or something that completely heals and goes away, most of the time it sets the patient up for a problem in the future that when the pain could return. So I think I look at things as a multimodal approach with multimodal like interventions. You're talking one injection is not perfect for everyone. One medicine is not perfect for everyone, but a medicine or an injection can help with pain instantly or initially, right?
Yeah.
Create the window of opportunity, and then that's where the work comes in, right? The work comes in with your physical therapy team, changing the kinetic chain, changing the structural integrity, providing that endurance to those muscles, providing better scapular movements or patellar tracking movements so that we don't keep causing recurrence or aggravation. And so, like I said, the work doesn't stop when you leave my office. I consider myself an educator, an advisor, and a guide. But after that, you also have to take it upon yourself to help yourself.
Absolutely.
So I will create that window of pain-free to get you out of that stress zone or that hot zone, so that allows you to do the exercises, do the therapy, or whatever it may be to continue in a good functional state without pain.
Yeah. And that makes for the perfect, just, hand in glove type of collaboration.
It absolutely is. You alone can't do it. I can't do it alone. It's the team effort, and the patient is part of that team. The patient themselves is a major aspect of that team, and we are their guides, we are their educators, and we help them with our individual assets that as a team together, we get to the success line or the finish line.
Yeah, absolutely. And so you mentioned a little bit, Dr. Mines, imaging, and it doesn't always tell the whole story. You need context. You need to kind of corroborate that a lot with a physical assessment. Else it doesn't really tell you a whole lot. So this is kind of a follow-up question to that. Is there anybody that comes to you, really wanting to know how you're going to treat the MRI, what says on their MRI? And secondly, are there other common misconceptions about sports medicine or what you do when you have people come and see you in your office?
Yeah, I think both. I think those are great questions and great topics, and we could obviously talk about them for a long time. But just in summary, I think MRIs are this. This is my stance on MRIs. MRIs are great. They're great utilization as a tool, right? If we're looking at the MRI for answers only, and we're using only the MRI, I think they're a huge red flag. And so what do I mean by that? Well, MRIs will tell us everything, right? If I scan 100 people who are over the age of 65, I'm going to find arthritis, potential stenosis, radiculopathy, pinched nerves of the lower spine on almost everyone. Now, out of those 100 people, how many of them have back pain? I don't know. You and I are agree. We don't know. So I think taking the MRI and correlating it with the patient is an excellent use of that MRI. But unfortunately, in medical school and in residency and fellowship and in practice, we learn that these objective tests that are supposed to be completely objective do have some subjectivity to them. We try to keep them as objective as possible, but you're talking each MRI machine is slightly different, right? In terms of quality, depth of penetration of the scan. In terms of the people reading it, there is some subjectivity there too. I love radiologists. Believe me, I'm not talking badly about radiologists, but there is wide variability in radiologists, just like there's wide variability in doctors, sports medicine doctors included, just like there's wide variability in physical therapists. It's every field. And so even though we try to keep it as objective as possible, there's some subjectivity. And so to rely only on the MRI or the scan seems silly to me when we have so many other details or knowledge pieces or data points that we can use. So I'm not saying disregard the MRI, but I'm also saying bring this in and part of the discussion and use other aspects as well. And so in terms of misconceptions for sports medicine, you know, a lot of times I think people get injured and they fear the worst. And so they immediately say, I need surgery. And, you know, I think the misconception here is that, first off, the body is an amazing thing that, you know, think about when beyond modern medicine, you know, back when the Neanderthals around, there was people absolutely tearing their ACLs and were still functional. And maybe they didn't have as much range of motion, or maybe they had some instability of that knee, but they still went and hunted and gathered and worked with the team. So, you know, the body is an amazing thing that can rehab itself and heal itself on its own. Occasionally, it takes, you know, a surgical intervention to help that or to finalize it or make it to the point where we can compete at a high level. But a lot of the injuries we sustain on a daily basis or in sports will heal with time. So I make it a big point to tell my patients, you know, a lot of cases when it's applicable, I say, if we do nothing, this will get better. But how long is that going to take, right? Is that going to take 3 months, 6 months, a year? Is that going to take 6 weeks? So my interventions are geared at accelerating that recovery and getting somebody out of pain sooner. And that's where the physical therapy comes in. So I literally will tell the patient straight up, if you walk out of my office and do nothing, you'll probably be good. But again, I don't know when. So if you're looking to get better within the next week, next month, these are the things we got to do to get you better faster.
Yep. And it's exactly right. Those are the same types of conversations that I have with the general public and patients too. I think, you know, the more conversations, this is why I wanted to actually have a conversation with you as well, because the more conversations we have about these things, the more people can learn and understand that it's usually not just one thing. There's a host of things in the whole contextual picture of, you know, what you're dealing with. And then on the flip side, that the body is more resilient than we think it is, but we're so conditioned to think that, you know, we need to jump straight to surgery. So
it always comes back to that homeostasis. It works its way back. You know, same thing with everything in life. It reverts back to the mean.
Exactly. Yep. So along the same lines, what kind of problems, if any, Dr. Mines, do you see when athletes or active adults sort of just push through pain for too long before getting evaluated, if anything?
That's a good question. So, you know, here's the deal. Inflammation is not good for the body. We know this. Everybody knows this. And so if we keep this kind of chronic inflammation going, we can either make the original injury worse, such as a tear, right? We could tear further in the meniscus, we can tear further in the muscle. Or if we have joint inflammation, that inflammation unchecked in there for a period of time will lead to further degenerative changes. So I give the example of the patellofemoral syndrome in an athlete at a young age, right? You see this commonly 20s, 30s, you know, to time of development when things are elongating and the bones may not go as quickly as some of the tendons, ligaments, or muscles. But with that being said, or there's a muscular imbalance. With that being said, a couple months or even a couple years of this patellofemoral syndrome, you may get away scot-free, right? We can correct it. There's been no structural damage. You'll have a good quality of life and probably not have recurrence if we correct it and you maintain those exercises consistently. If we let that go unchecked for a decade, that patellofemoral syndrome will have some degenerative changes in there and you'll start having bone spurs. The bones try to remodel because they think they're helping you, but unfortunately you don't have a mold in there. And so when they remodel, they can create these bone spurs that move in areas where we need movement and they can become obstructions. And so with that patellofemoral syndrome may be harder to correct later on when now you have a bone spur in there, which is actually rubbing on that knee and that femoral condyle. And so that is harder to correct. So, you know, it's one of those things that occasionally pushing through pain is not the worst case scenario, especially if it's short term. But if we're pushing through pain over weeks, months, even years, at that point, we start having structural problems in there that are now harder to correct and may require surgery rather than some anti-inflammatories, an injection, or some physical therapy.
Yeah. And when do you, along the same topic here, when would you suggest that somebody should come see somebody like you? Or what are some warning signs that somebody should take that would kind of cue them to go say, hey, I need to go see someone?
Of course. Well, I think the first thing is this. If you're asking the question, it's never wrong to come see me, right? Best case scenario, I reassure you. It's a quick, simple visit. I usually run on time. I'm quick and aggressive. And so with that, I'm happy to provide reassurance, and I love doing that. But at the same time, a simple rule of thumb is a couple days, right? If we have an injury, typically 48 to 72 hours is the inflammatory period. If after 48 to 72 hours, everything seems to be functioning normally, motion, strength, no numbness and tingling, and the pain seems to be improving, we likely had a small little overuse injury inflammatory reaction, and it's likely going to quell on its own. If you start seeing skin changes, major swelling, bruising, prolonged pain, or definitely functional loss, meaning motion, strength, weakness, decreased sensation, those are things that we want to seek help a little bit quicker.
Yeah, absolutely. Any advice, Dr. Mines, that you would have for somebody that wants to kind of take a step forward and just putting their health first, whether that is kind of making the decision to come see you or at least paying attention to it?
Yeah, I think, most people have primary care physicians. I think running it by their primary care physician is a good first step, especially if you're already there. Mention it to them, see what they think. I think another thing is, pick up the phone and call. I mean, you could also see a physical therapist, right? So the state of Florida, and correct me if I'm wrong, allows for a month's visit without having a doctor's order. And so physical therapists are extremely knowledgeable. And the other aspect is they get more time with you, right? My 5 to 10 minute visit, we may be able to get through a lot, and we typically do, but we may not be able to get through every little assessment of motion of that joint or every strength measuring of that joint. And so, getting with a physical therapist and saying, hey, is this something that we can work on over the next month, or something that I can do on my own, or is this something you think I need to go see a doctor for? I mean, all these are great resources to try to guide that. And when in doubt, just pick up the phone call. We're happy to do it. And best case scenario is about 1 or 2 people a day. I say, you know what? You got nothing going on here. This is fantastic. Go live your life and call me again if any concerns or questions arise. And I have no problem doing that. Those are some of my favorite visits. We turn those into social visits, and I get to know the local community.
Yeah.
And it's always nice to deliver good news rather than always telling people, oh, you got a fracture. Oh, you got terrible arthritis.
Yeah, definitely. One more question kind of about the clinical side, just to make sure that anybody that does listen doesn't get kind of the wrong picture. When somebody hears, he's a sports medicine physician, just to kind of recap on this again, if someone's listening thinking, well, I can't see this guy, he sees athletes. So is that something that's not true, or can you kind of explain that a little bit?
That is absolutely correct. So with that being said, I do not see only athletes. Even if you don't consider yourself to be a true athlete, I see all sports musculoskeletal conditions. So not just sports related, but musculoskeletal conditions. I see everyone ages about 3 to 105. I will even go higher than that if somebody wants to. But yes, my door is open to anybody. The reason I chose athletes and I work with athletes is because they have a drive to get better. If you share that drive to get better and increase function and less pain, that is the right person for me. Come on into my office anytime.
Good point. Yeah. And speaking of that, you are located primarily in South Pasadena, St. Pete area, All Florida.
Yep, I work for All Florida Orthopaedics, which is a division of Florida Orthopaedics out of Tampa, and I work in the Pasadena office. We may be branching out to our new 4th Street location. We're building a brand new building up at the north end of 4th Street, and I may be over there, but for now I'm down in South Pasadena. I know it's a little bit of a hike for some people, but it will be worth your time, trust me.
Awesome. Yeah, and so how can people get a hold of you to schedule?
Excellent. That's a great question. We have a main line, and I can give the phone number here if you'd like me to. That's the best way to reach out. Obviously, if you have trouble scheduling with me, which you should not, because my team is very good at that, you could always reach out to your primary care, and they can provide you a referral as well. But our phone number is 727-527-5272.
Awesome. And I will make sure that's also posted. So, well, there you have it. That's it. Dr. Mines, I really want to appreciate or say thank you, and I appreciate your time and coming on and talking to us and sharing a little bit about who you are and what you do. So thank you for what you do in our community and to my patients and to all your patients as well. We really appreciate you.
Well, Ken, I want to say thank you. I think this is an excellent session. I think this was a great topic to discuss. I imagine you have some other great people on here as well. And I appreciate you educating and advising the community and your patients. And I also appreciate personally what you do with our patients. You are an excellent PT. And so I'm going to give him a quick shout out that if you are needing anything like we talked about, Ken would be a great choice, as well as the rest of his team over at Purpose Physical Therapy. So thank you so much for having me. I'm humbled and honored to be here, and I look forward to working with you in the future with more patients and more success stories.
Likewise. Thanks so much.